So welcome to Module 10. Today we'll be talking about drugs and consciousness. So the effects of various psychoactive drugs, both prescription and recreational, on the brain. So we'll be talking about the tolerance, dependency, and addiction, which are characteristics of drugs, and then the different types of psychoactive drugs, the depressants, the stimulants, and the hallucinogens, and then some biopsychosocial influences on drug use. So drugs are defined as psychoactive drugs are defined as chemicals introduced into the body which alter perceptions, mood, and other elements of conscious experience. Many of psychoactive drugs can be harmful to the body. Psychoactive drugs are particularly dangerous because people become dependent or reliant on the substance. And factors related to addiction include tolerance, withdrawal, and the impact on daily life on substance use. So I'll be differentiating between physical and psychological dependency. Here's tolerance. And what tolerance basically means is that the more you use a substance, the higher the dosage of the drug it takes to get the same effect. So for instance, you may start out by taking 200 milligrams of Advil, which is one tablet of Advil for your pain. Let's say you have bad headache. You take one tablet of Advil to start. Now that works pretty well for like a month or so, and then all of a sudden that 200 milligrams of Advil doesn't work anymore. Now you got to take more. You take 2 tablets or 400 milligrams, and you get the same relief that you originally got with 200 milligrams. So you take the 400 milligrams for a while, and all of a sudden that doesn't work. You need to take 600 milligrams or 3 tablets. So you keep increasing the amount you're taking to get the same desired effect. Same thing that you might be familiar with regard to alcohol use. Normally, at the start of drinking, when you never drank before, you take 1 beer, and 1 beer is enough to get you buzzed. And then all of a sudden, 1 beer doesn't do it anymore. Now you need 2 beers. Then you need 3 beers. Then you need 6 beers. Then you need 12 beers. Then you need 24 beers. So you've gotten adjusted to taking in that much alcohol. You've built what's called tolerance. You need more alcohol to get the same buzzed feeling if you keep drinking alcohol. So tolerance basically refers to needing more and more of the drug to get the same effect. Now with tolerance comes withdrawal. Withdrawal is the painful symptoms of the body readjusting to absence of the drug. And withdrawal becomes worsens addiction, I should say, because users want to resume taking the drug to end withdrawal symptoms. And the biggest problem here is heroin withdrawal, where you're a heroin addict and then you're going through withdrawal within a few hours. Within a few hours, you need to take more and more of the drug. Otherwise, you start getting the physical withdrawal symptoms, which are nausea, vomiting, anxiety, bad anxiety, panic, insomnia, etc. So then you're looking for the drug. You're actually planning for the drug. When will I get my next dose of the drug to end this withdrawal symptoms? The easiest way to end the withdrawal symptoms is take more of the drug that you're abusing. You take more of the drug, the withdrawal goes away. And that's why if you're an opiate or a heroin addict, it's very hard to get off of it because within a few hours, you're getting very intense withdrawal symptoms and you need to have the substance. And you'll do anything for that substance to end the withdrawal symptoms. And then you end up taking the drug not because you enjoy the drug, not because of the positive effects it brings, but because of the withdrawal symptoms. You want to end the withdrawal symptoms. So there's 2 types of dependency that I'm going to talk about: physical dependency and psychological dependency. Physical dependency is the body craving of the drug. Physically, there's physical symptoms when you don't have the drug. So if it's alcohol, if it's cocaine, if it's heroin or opiates, the vast majority of methamphetamine, the vast majority of very dangerous drugs include physical dependency. There's a physiological withdrawal effect. If you don't have the drug, your body has physical withdrawal symptoms. Then you have psychological dependency. This is not to do with physical withdrawal symptoms. This is to do with needing the drug because it's an important part of your life. For example, you need the drug to relax or to socialize or even to sleep. And most drugs have both physical and psychological dependency. However, a drug like marijuana has very limited physical dependency. It's mostly psychological. You mostly want to use marijuana because it's part of your life, not because you have these physical symptoms. that are demanding that you take marijuana. So marijuana is one of the exceptions. It's mostly psychologically dependency and very little physical dependency. But the other drugs like alcohol and meth and all of these drugs, these are all both physical and psychological. The other things that would be psychologically dependent would be non-drug related activities like gambling addictions or porn addiction, sex addiction, internet addiction, or social media addiction. There's no physical withdrawal from these psychological addictions. It's all just part of disrupting your daily routine, part of your life, an important part of your life. So those fall solely under psychological dependency. So that brings me to the idea of dependency of either a substance or an activity. Dependency includes tolerance, the need to use more and more of the drug to receive the same effect. It includes withdrawal, which is the distress experience when the drug wears off, or the effect of the drug wears off. You use more than intended of a particular substance. You have persistent failed attempts to regulate the substance use, so you can't stop. You may actually try to stop, but you can't. You spend much of your time or much of your life preoccupied with the substance, obtaining it and recovering from the substance. So you constantly think about it. So let's say you're a heroin addict, all you can think about is heroin. I need this, I need this, I need this. Whether you're at work, whether you're at school, whether you're in your home, it doesn't matter. You're constantly thinking about obtaining the drug. You reduce important activities because of it, so you no longer want to go out with your friends. You want to stay home and use drugs. You only care about drugs. Everything else, you don't care about bathing. You don't care about hygiene. You don't care about making money unless the money is used for the drug. You don't care about having fun, your family. That means nothing. All you care about is the drug. And you continue to use it despite you having aversive or negative consequences. So you know it's killing you, but you can't stop. So I'm going to start by talking about the first category of drugs, and these are the depressants. These slow down brain activity and other bodily functions. And these include alcohol, the barbiturates, and the opiates. So alcohol slows your sympathetic nervous system activity and slows your reaction time. It also reduces memory formation and disrupts REM sleep. So even though you may feel like you fall asleep and you slept well with alcohol, you're not getting the deep restorative sleep. You're not getting REM sleep and you're not getting non-REM 3 sleep. So you're getting very shallow, mostly non-REM 2 sleep on alcohol, and that's not enough. So you're going to be sleep deprived. You're going to be cranky, not restored. You're going to feel beat up. Even though you might sleep through the entire night, you're not getting that deep sleep. Alcohol also causes impaired self-control and self-judgment. So it decreases your inhibitions, so you're more likely to act on impulses, which can be good sometimes. But it's not good when it comes to driving your car because you're getting into car accidents. It's not good because it can make you more aggressive. You could become belligerent, start fights with people that you normally wouldn't start fights with people, get yourself beat up, get yourself killed. So there's a lot of negatives. So just because it may relax you and allow you to socialize a little more doesn't make up for the fact that it also makes you more prone to take risks that you normally wouldn't take. And those risks can be very dangerous. It also destroys your brain. So it slowly kills brain cells over time. If you look at the fMRI, or this is actually an MRI, not an fMRI, just an anatomical image, three-dimensional image of the brain. You see the woman without alcoholism, you see those empty spaces in the middle of the brain? Those are called ventricles. Those ventricles are normal shaped in a woman without alcoholism. If you look at the bottom picture, the ventricles are way enlarged. And that's a woman that's an alcoholic. And what this is showing is that your brain is actually being destroyed by alcohol and other drugs. And you're going to end up with a lot of empty space in the ventricles, and that can cause memory problems. It can cause, motivational problems. A bunch of different things can occur. But you're killing your brain. And there's no way to make up for that. Whether it's alcohol, marijuana, any of these drugs is leading to neuron death in the brain. Now, alcohol is a very dangerous drug, and in my opinion, alcohol is the most dangerous drug of them all because it's legal and it's readily available. Barbiturates are very dangerous as well. They depress the central nervous system to a great degree. The good thing about barbiturates is that you're not going to get them. No doctor is going to write a script for them because they're that dangerous. Examples include Nembutal, Seconal, and Amytal. These used to be used as sleeping pills back in the 50s and 60s. These are the old sleeping pills. And they're very effective at helping people sleep and reducing anxiety. The problem is when they're combined with alcohol, they could become deadly. So you combine them with alcohol and it leads to respiratory depression, which means you stop breathing. And obviously you know that breathing is a prerequisite for living. So people were dying when combining this with alcohol. And it's very easy to say, don't combine with alcohol. The problem is people will do that. People will drink, and remember that when you're drunk, you tend to not really look at future outcomes. You tend to be more impulsive, and you're not planning about the actions. You're not looking at the consequences of your actions as much. And so if you're drunk and you say, oh, I can't sleep, or I want to relax even more, and you take a barbiturate, you're in trouble. And you could die. And there are many famous people that actually have died by mixing barbiturates and alcohol. So barbiturates are almost never used today. They're used sometimes in certain surgeries, but they're almost never given as a drug used as an outpatient. And if you asked your doctor for, Nembutal or Seconal, they would look at you like you're crazy. They may not even know what you're talking about. They will never write for these prescriptions. And finally, we arrive at the opiate drugs, which are the highly addictive depressant drugs derived from the opium poppy. And the opium poppy is primarily found in Afghanistan, harvested in Afghanistan. And the opium poppy is used to make synthetic opiates like morphine, Percocet, heroin, etc. Fentanyl eventually. And these are very effective pain relievers. So they reduce your nervous system activity and it reduces anxiety, but it really works effectively on pain. So all your painkillers, whether it be Percocet, Vicodin, Dilaudid, fentanyl, very potent opiate drugs, painkillers, very effective, and there are plenty of people in pain that need these drugs. The problem is that there's a small segment of the population that gets addicted to these drugs. They get the euphoric feeling from the opiates. Many people do not get euphoria from opiates, but some people do. And once they get that euphoric feeling, they don't want to give that up. And they start abusing the drug. And these drugs, you develop tolerance very rapidly. So you have to be very careful because you build tolerance very rapidly. And you end up taking more and more of the drug to get the same effect. And there's also severe withdrawal from the opiates. So there's a lot of problems with these opiate drugs. High doses, as I said, produce euphoria, but even low doses will produce euphoria in a certain segment of the population. And this is why, that if you're going to a pain management clinic because you have serious pain problems, and they write you a script for opiates, they're going to watch you. They're going to drug test you to make sure that you're taking exactly what they're giving you, that you're not selling it on the street to make a huge profit, because the street value of these drugs, like Percocet street value, is pretty high. You can make a lot of money, selling these drugs, so they have to be regulated very tightly. Opiates work at the body's natural pain receptors. They're called endorphins. They're the body's natural painkillers, or they're called endogenous opiates, endorphins. These opiate drugs bind at the endorphin receptor site, and that's how they relieve pain. The problem is once you start taking opiates, the body stops making endorphins. And then if you then stop suddenly taking the opiate, there's a big deficit in endorphins, and as a result, the withdrawal is very severe. In the case of heroin use, and heroin's probably the most abused opiate, you can't withdraw off of that just cold turkey. You can't just say, oh, today I want to stop using heroin. It's just not going to happen. You could try to withdraw off of it by 6, 12 hours. The dope sickness is so severe. You're vomiting, you're in pain, you're anxious, you're just miserable. You're really miserable, and you'll do anything to end that withdrawal symptom, including taking more heroin or taking more opiates. And so to get you off of heroin, which is a really toxic drug and associated with the high levels of overdose, there's a couple of different ways. You have methadone, which is the old way of withdrawing from heroin. Methadone is a very potent opiate, but it's just as addictive as heroin. The difference is that methadone, you will not overdose on methadone like you would on heroin. So you're not going to die on methadone like you're going to die on heroin. Heroin, you never know, when an overdose is going to occur. Many, many people OD on heroin, and we can't save them. Methadone doesn't have that problem. So you could be on methadone, but it's a very potent opiate that's just as addictive as heroin. But you could be on that your whole life. The problem with methadone is, let's say you don't want to be on your whole life. You want to get off of it, mainly because it's toxic to your body, especially your liver. If you try to get off methadone, it's going to be very hard. You may not be able to do it. And that's why methadone has been replaced by Suboxone. And with Suboxone, you can get off of your heroin or your other opiates, and then you can actually get off of Suboxone, gradually withdraw from it. So Suboxone has replaced methadone as a better method. And the last method would be Vivitrol, which is a shot, and it's supposedly very effective. I don't know how it compares to Suboxone, but it's a newer treatment, and it's shown to be very promising in helping people get off of heroin. So there's ways of getting off, but you need help. But there's always ways of getting off heroin. No one should be on heroin. There's ways to get off of it. Even if you feel like you're on a dead end, there's ways to work around it. And there's plenty of recovering heroin addicts. Yes, they have to work hard to stay off of heroin, but they're off of heroin and their lives are so much better than they were. So we're going to move on to the next category of drugs called stimulants. Excuse me. Some physical effects of stimulants include dilated pupils, increased breathing, increased heart rate, increase in blood sugar, and decrease in appetite. Stimulants just basically increase sympathetic nervous system activity. They increase bodily function. They speed up your brain, so they make you more alert, make you less tired. And you're all familiar with caffeine. And caffeine is a relatively safe drug if used in appropriate dosages. That means you're not drinking like 20 cups of coffee a day. Caffeine is relatively safe, makes you very alert. However, you still develop tolerance, which means if you're a big coffee drinker, you never started out as a big coffee drinker. You maybe drink 1 cup. And then, eventually, if you keep drinking coffee over and over again every day, you start drinking more and more to the point where you're drinking a lot of coffee to get the same effect. And with tolerance, you have withdrawal effects of caffeine. They usually last between 1 and 2 weeks. Then you have nicotine, which is more potent than caffeine, and that's the active ingredient in cigarettes, cigars, hookah. Then you have amphetamines, which is speed. These are also found in diet pills. Methamphetamine, which is crystal meth, which is a very potent version of amphetamine. A very, very potent stimulant. And very much abused. And then you have cocaine/crack, which is kind of falling out of favor these days. And ecstasy, or MDMA, or Molly, which is in favor and a party drug for most people. Starting with caffeine, adds energy, disrupts sleep for 3 to 4 hours. It can lead to withdrawal for a week or two, where you feel very irritable, cranky, miserable, tired, sleep problems, can't concentrate. And then the other withdrawals are headaches, of course, irritability, fatigue, and a little bit of depression. It'll go away within a week or two. But otherwise, caffeine is relatively safe if used in moderation. Now, if you somehow drank like near 100 cups of coffee, in one day, which I wouldn't advise, and I don't see how that's even possible. You could put yourself kind of close to a seizure threshold where you can end up with a pretty severe seizure from drinking so much caffeine, but I've never seen anyone come close to 100 cups or plus of caffeine a day. That's the equivalent of maybe 400 cans of soda. So as long as you're not drinking like a radical, ridiculous amount of caffeine, caffeine is fairly benign. However, you can get arrhythmia from it. Uh, there are certain energy drinks that you can get arrhythmia from. Like the Red Bull energy drink. This is you have to be very careful with how much of this you're consuming because there's a lot of caffeine in there. You can get a heart arrhythmia, or it can trigger a panic attack. You might think you're having a heart attack, but you're having a real anxiety attack. So there are problems with this if used in excess. So nicotine has many effects, and nicotine is predominantly found in cigarettes, cigars, and also hookah. Nicotine increases arousal to your brain, increases alertness, increases heart rate and blood pressure. One of the really bad side effects of nicotine is cardiovascular disease, so it increases your risk of heart attack and stroke. It reduces circulation to your extremities and makes it more likely that you end up with gangrene in your fingers and your toes, and that requires amputation. It may relax people, and it may suppress your appetite for carbohydrates and lead to weight loss. But these symptoms or these effects are not to outweigh the effect on the cardiovascular system. A great increase in heart rate and blood pressure that could be fatal in some people, causes heart attack, leads to stroke, and in general, the risk factors are not worth the small rewards that nicotine brings. You can withdraw off of cigarettes if you're addicted. There's ways to help people that are addicted. The ways that involve not taking nicotine. And one very powerful approach is Zyban, Z-Y-B-A-N. Zyban contains the antidepressant Wellbutrin, Wellbutrin, Wellbutrin. And this is a powerful antidepressant that stops the craving associated with cigarette use or smoking. It's a very effective treatment that you can get, and it does not contain nicotine. If people can't quit cold turkey, quitting cold turkey is hard, but quitting with Zyban or even Chantrix, which is another one, these are very effective measures. And so if you're a smoker, really you really have to stop smoking, and Zyban would be a very effective strategy. Smoking not only hurts your heart, but the carcinogens in the cigarettes will lead to a high rate of lung cancer and other cancers, and it's just not worth it. In the long run, it's not worth it. Cocaine blocks the reuptake of three neurotransmitters: dopamine, serotonin, and norepinephrine, and that's how it predominantly works. And it produces about 45 minutes or an hour of euphoria, which is the main reason why people are taking it. They just feel amazing. And then there's a crash. So after the euphoria wears off, you crash. You feel agitated, depressed, increase in pain. You feel miserable. People may chase the high of the cocaine with, like, say, Xanax or some other benzo to reduce the impact of the crash state. People develop tolerance over time pretty rapidly to cocaine, and cocaine can also be associated with convulsions, heart attack, stroke in people that are susceptible. So cocaine is fairly addictive. You can get off of it, but it's fairly addictive, and it can lead to hypertensive crisis where your blood pressure is so high that you're at risk for stroke or heart attack. It can be dangerous in that way. And cocaine can be mixed with other cheaper products and watered down to form a substance called crack. And so as cocaine was inhaled mostly, crack was smoked. And it can get into your bloodstream a little bit faster, but it's kind of a diluted version of pure cocaine. and it was pretty popular. It started on the West Coast in the mid-1980s and was pretty popular in the 80s and 90s. And that brings me to methamphetamine. Meth is much more potent than cocaine. It triggers about 8 hours of euphoria and energy. And then after that 8 hours, you got the horrible crash again. Insomnia, seizures, hypertension, depression. And meth is a very potent weight loss drug, but this is not a reason to use it. It causes lots of other side effects, physical side effects, like the face picking that you see in the picture on the screen. And you could probably look it up on the internet and see tons of people that are meth users, and they're picking at their skin to the point where they're bleeding. They're picking at their face. They describe it like bugs crawling under their skin, and they're picking at those bugs, and they'll just dig at their face till they bleed and they scab over, and it's just really disgusting looking. It also dissolves their teeth, so they lose their teeth. Their teeth basically dissolve in their mouth. It's just another disgusting aspect of meth use. So meth is just terrible for you, and it's a big epidemic, especially in the middle of the country. So the East and West Coast is still primarily heroin users. There's lots of heroin on the East and West Coast. The middle of the country is primarily meth addicted. And we have a meth epidemic that we need to stop. Because not only is it killing people, if it doesn't kill you, it can make you psychotic. It leads to psychosis. It makes you feel that people are chasing you, that they're after you, that someone's trying to get you. And many people end up in a hospital screaming that they're being attacked, and there's nobody there. And they have to be sedated or put in a straitjacket. And it's a very hard situation to be in. And meth is on the rise, and it's a big problem in this country. Ecstasy and MDMA, or Molly, the new version, Molly. Ecstasy is a synthetic stimulant that greatly increases dopamine, but it causes a ridiculous upshoot in serotonin. So basically what ecstasy does is it calls all the stored serotonin in your neurons that have serotonin to be released at once. So it floods your brain with serotonin. As a result, you feel euphoria. You feel socially connected to everybody around you. Like the world is a great place. Everybody, you love everybody. It's an artificial feeling of intimacy. And ecstasy used to be legal in the 1980s. In California, there were marital therapists that were giving ecstasy to their clients. And they would take ecstasy and they would say, wow, everything is great. I love my partner. I love our relationship is wonderful. And ecstasy did more for these marital problems than did years of marital therapy. This is when ecstasy was legal in the 1980s. The problem was that once people started using ecstasy in the therapist's office, of course it got out and people said, wow, ecstasy is great. Let's use this at, this is a party drug. Let's use this at clubs. And so it got into the club scene, and that's when the negative aspects of ecstasy started to emerge. And those negative aspects are dehydration, very high blood pressure, very high body temperature, and that led to deaths. So people started dropping dead in the clubs. As a result, the government got involved and ecstasy was made illegal. Now, if you make it past the immediate death that the drug can cause, you can end up with prolonged depressed mood, because ecstasy is causing all the stored serotonin to be released. It damages those serotonin producing neurons permanently. And so people that took ecstasy for months to years on a regular basis ended up with damaged serotonin neurons. And they were in a chronic state of depression, which is a huge problem. And there was no solution for this. It also disrupted your circadian rhythm and your sleep cycles and impairs memory. But nothing is worse than damaged serotonin neurons because they can't be repaired. And that leads to chronic depression. And that was the main long-term take-home from ecstasy. It also suppresses your immune system, but that's minor compared to the depression part. Then we have hallucinogens. LSD, lysergic acid diethylamide. They interfere with serotonin transmission. And the hallucinogens cause hallucinations, which are false images or false sensations. Visual hallucinations are false images. You could also have auditory hallucinations, which are false. You hear things that aren't there. Olfactory hallucinations, you smell things that aren't real. So you have a bunch of these hallucinations. People that take LSD also have something called synesthesia. They have a blending of the senses. For example, they report seeing sounds. So their sensory modalities get mixed up. However, LSD is fairly safe. You really can't overdose on it. The only problem is some people that use LSD, after they stop for a long period of time, they may have spontaneous hallucinations, and that kind of scares them. And the reason is because LSD is hiding somewhere in the body, maybe in the spinal cord, and it's having an effect months to years later. So you may not use the drug for like 2 years, and then all of a sudden you start having a hallucination out of nowhere. And that doesn't sit well with a lot of people. And that's a possible effect of LSD use. And then we have marijuana, which surprisingly, but it's surprising, but it's filed as a mild hallucinogen. It's characterized as a mild hallucinogen by the government. The active ingredient in marijuana is THC, tetrahydrocannabinol. And marijuana binds to the brain's natural cannabinoid receptors. So the brain has natural receptors for marijuana. So the brain has to make a natural marijuana-like substance, which is interesting. And marijuana will bind to those cannabinoid or endocannabinoid receptors, right? Brain receptors that have marijuana-like substances there. And marijuana is fairly safe. It's a lot easier than alcohol on your liver, so it doesn't destroy it will destroy your brain, but you can live with a destroyed brain, with brain cell death or brain death. You can't live without liver, so it's easier on the liver than alcohol. In that way, it's safer. And it's gotten a lot of negative press for some reason. The government puts it in the same category with like heroin, as far as dangers of the drug. It just has gotten a bad rap. Marijuana could be very effective for pain regulation. It's very effective to reduce nausea. It's also effective for treating glaucoma. And on consciousness, it can improve your mood. It also can make you paranoid and can trigger a panic attack in some susceptible individuals. So it's not all positive for everybody that uses it. It can have negative effects in some people. And also lacks your ability to sense satiety, which means that you have a hard time telling that you're full. So it increases your appetite by a great degree. So it's good for people that have a lot of nausea, like from chemotherapy, cancer patients. Marijuana is very effective for cancer patients. They may not have any appetite, and they smoke marijuana, and it improves their appetite and reduces the horrible nausea from chemo. So there are a lot of positive effects of marijuana, but it will destroy your brain cells. That's known. And no, it's relatively safe. You can't really overdose on it. You would need to smoke like a truckload of marijuana in one sitting, which I don't think you have a truckload of marijuana on you. So you're not going to do that. So in that way, it's relatively safe. But there are some reports of marijuana being linked to the triggering of schizophrenia. And people debate that research. People debate those findings. But there are findings linking it to triggering of schizophrenia in certain individuals. And it is known to also trigger panic and anxiety in certain prone individuals. So there are negative aspects as well. And it impairs your reaction time. Obviously, it's like alcohol. You don't want to smoke and drive because it's going to really affect your driving ability. And it accumulates in your body, increasing the effects of the next use. And it stays in your body for a long time, THC, the active ingredient in marijuana. So you got to take that in consideration with regard to like drug testing and stuff. It stays in your body for a fairly long time. And it can destroy brain, as I mentioned previously. And of course, you have smoke inhalation damage. So it's got the negative aspects of smoking as well. These are summary tables for the drugs that I talked about here, so you should be very familiar with these tables before we move on to the next. Here's the second table and the negative effects.